Hi, I'm Dr. Jayme Jacobs, and I'm a licensed clinical psychologist at the Center for Emotional Health of Greater Philadelphia. This video is for the graduating class of 2020. In the recent shutdown of the country, the end of your senior year has been forever changed. All the events you were eagerly awaiting were canceled, and the remaining time to cherish with friends and teachers was cut short. These circumstances have left many students grieving. If you find yourself having a hard time managing, here are 5 tips for coping with these losses. 1. Accept your thoughts and feelings. We've learned through much research that the more we resist negative thoughts and feelings, the stronger and more frequent they become. Perhaps you've been thinking, I'll never be able to get this time back again. Or maybe you've been overwhelmed with feelings of anger. Try your best not to shut out whatever it is that comes up for you. Daily mindfulness can help with this. Try closing your eyes, taking a minute or two to ground yourself in your breath, and then observing any thoughts, feelings, or sensations that arise. The aim is to simply watch as they come and go, as if you were an outsider looking in. If you get distracted or find yourself feeling fully consumed by it all, gently remind yourself to come back to your breath and resume watching from this observer point of view. It's normal to get knocked off course repeatedly and to have to reset yourself many times. Mindfulness requires practice, and like a muscle, strengthens with repetition. 2. Foster self-compassion. Be aware of any unnecessary judgments you make towards yourself that increase your suffering. One way to increase self-compassion is through the use of mindfulness, since it encourages you to simply watch your thoughts and feelings without judgment. Another way to foster greater self-compassion is by revising your judgmental thoughts. Let's say you're judging yourself for being sad about missing your graduation when many people have it much worse right now. You might try reminding yourself, I'm entitled to be upset about this, even if my situation is less severe than others. Graduation really mattered to me, and so it is understandable that I feel this way. 3. Don't compare yourself to others. Self-comparison involves evaluating others in order to determine how your own experiences, attitudes, and abilities measure up. Social media usage has increased during quarantine and is a common trigger for self-comparison. Perhaps you've taken notice that a lot of your friends seem normal when you feel anything but. There's no person in your shoes right now, and so comparing yourself to anyone else is not a good measuring stick for how you're doing. Although you may have gone through a similar set of experiences and losses as your peers, you are unique, and it's perfectly reasonable that your psychological response is different. Focus on validating your current experience, regardless of where others stand. 4. Choose healthy resources for coping. A lot of great resources have emerged in regard to healthy coping strategies for managing during this time. Seeking support from loved ones and friends, creating daily structure, focusing on what you can control, getting plenty of exercise and sleep, eating well, virtual socializing, practicing gratitude, and engaging in other pleasant hobbies and productive activities are several things you can try. However, it's also important to be on the lookout for unhealthy coping strategies that you have been relying on to feel better. On the milder end, maladaptive coping strategies might include excessive sleeping, overusage of television or social media, or emotional eating. On the more severe end, these may appear in the form of substance abuse, binge eating, or self-injurious behavior. Although these behaviors may be used as a way to escape your struggles in the short term, they do little to help ease the distress you're actually facing, and so you find the same problems exist when you disengage from those outlets. Additionally, they can cause or exacerbate guilt, shame, depression, anxiety, and other mental health difficulties. Aim to replace unhealthy behaviors with healthier alternatives. If you're struggling to do so, don't be ashamed to seek professional help. 5. Create meaningful substitutions. As your acceptance for these losses increases, consider meaningful ways to commemorate the missed milestones and events. You deserve to honor your hard work and achievements, as well as bring healthy closure to important relationships. Although you didn't have control over the cancellations and lost time with people, you do have control over your actions now. Across the country, students have been finding clever, non-traditional ways to celebrate the end of their senior year. Think about what substitutions might help lift your spirits and stand in for the lost experiences you are grieving most. I hope you found this useful. Please feel free to share it. My colleagues and I at CEH are dedicated to specialized care in the evidence-based treatment of anxiety disorders, OCD and related disorders, and neurodevelopmental disorders. We're available to provide telehealth via secure internet video conferencing. Thank you for watching. Be well.